Guys, I'm here with Dr. Allison Zisman. She's a board certified dermatologist. She's a friend, a colleague, and also a patient. And so while I have her in the office and I'm going to do some stuff for her, I figured, we can talk about some stuff. So, Allison, you're here for temple fillers. We're going to do some fillers in your temples. So, tell me about what bothers you about the fact that you think your temples have become hollow.
Right.
Yeah.
So I feel like I started noticing it. It was after I turned 40, I guess, in my early 40s. When I looked in the mirror, I felt like I was, which you do with time naturally. You have lipoatrophy or lose fat in areas of the face, but people don't always notice as much in the temples. But for me, it was like very distinct because I felt like it gave me not only like more of an aging look, but also a masculine sort of look for myself. And so when you look straight in, just these areas here, I feel like start to sink in, just like you can lose fat in this area. And so I think we started doing it around maybe 5 years ago.
We've done
a
few times for you now with temple fillers. And so when you fill, and we fill your temples with Voluma, which is kind of the heaviest filler that we have. How long does the Voluma last in your temples when we put the Voluma?
I feel like a year.
About a year? Okay.
Yeah.
So that's interesting because, the on-label Voluma longevity studies have allowed Voluma to claim to last up to 2 years, but I think the interesting trick word is up to. So when we say up to, it's up to 2 years. That doesn't mean necessarily it lasts that amount of time in everybody. Yeah. So yours lasts about a year in your temples?
Maybe a year and a half. It depends. I don't necessarily feel like 2 years, but it could be more than a year.
Yeah. But we've been doing Voluma in the temples for years and years and years, but I think recently it's become more popular in terms of patient understanding and recognition that your temples caving in as you age actually does really contribute negatively to your overall kind of cosmetic outcome, right?
Yes, and I feel like when it gives your face when it's filled more round shape up here and more like that the normal aesthetic that you want. In addition to the cheeks and the other areas, it's not something people notice as much until you're looking at the whole face or at the right angle. So.
Yeah, and also I think that obviously cheek fillers have become very popular. So a lot of people focus on the cheeks by putting fillers in the cheeks and raising the cheeks, which gives you a nice lift. But I think by filling the cheeks, that also contributes to the look that your temples are more hollow because your cheeks are filled in, and this looks more hollow in relation to your cheeks that are filled up in most people, right?
Yes, and then your eyes start to go somewhere else, and
right.
It's more noticeable.
Exactly. So I think the bottom point is that it's nice to kind of look at the face holistically, I think, and kind of address all the areas that are potentially losing volume and not just necessarily one focal area, let's say just the cheeks or that, but we have to create a more harmonious look all throughout.
Exactly.
Yeah. So guys, temple fillers, I'm actually going to show you how I fill in Dr. Zisman's temples with Voluma. Guys, we just finished doing your temple filler. How was it?
It was pretty easy.
Right? I mean, we didn't use any numbing cream, right?
No numbing.
Just ice. The filler has some numbing in it. Did you feel much?
No, you feel a little pressure maybe, but
a little pressure in that area.
Pain.
Yeah, and the pressure is because we're putting it deep on the bone, which is that's where we have to be on a safe plane, right? So, and it's a very safe plane because when you're on the bone, there's no blood vessels there. And you could see, there's barely really any bleeding, just with the shot that we went in, barely nothing, no bleeding, no really swelling. You'll ice a little bit, and that's really it.
And off to Marjan.
There we go.